Good morning and warm welcome, and thank you for keeping it right here on Sunrise at CU, just in time for your beauty, wellness and lifestyle segment. My name is Shivan, and today I am with the good doctor, and she is an ear, nose and throat specialist, as you might call them, an ENT. And today our major emphasis of discussion is that we're going to be looking at adenoids and tonsils. Now we're going to be looking at also tonsils enlargement and getting to understand, first of all, who is prone to this? How can you tell that you're actually suffering from this type of condition, and what is the treatment? I mean, very many children, and this particular condition is actually very common in children. Your child snores at night and you think that they will outgrow it, or you think that they're probably sleeping badly, but hey, guess what? This is actually a condition that needs to be addressed. So with me is the good doctor, and I'll give her the honors to introduce herself. Good morning, doctor.
Yes, good morning, Shivan.
Thank you so much for joining us this morning on Sunrise at Sea.
Thank you. I'm Dr. Hidur Rim. I'm an ENT surgeon working with Yasmin healthcare specialists.
Okay.
Thank you for being here.
Absolutely. So my first question is, what are these adenoids and tonsils? Like, break it down for us.
So adenoids and tonsils are organs that are part of the immune system, which are localized around your upper airway system, so the nose and the throat, your mouth. So these organs are part of another complex system of immune organs, which are going to defend you from any intruders like bacteria and viruses, which enter through your nose and throat. So we have very many of them, but the most frequently affected with disease are the adenoids and the tonsils.
Okay.
Yes.
So at what point do they begin to enlarge?
So most of the times, because they are defending you from infections, they are going to enlarge in case of any throat infection. If you have a cough and a flu and sore throat, you feel like you're having pain, you most likely are having a throat infection where the tonsils and adenoids are going to enlarge. But most of the times when you just manage them medically, they are going to become all right.
Okay.
But sometimes they don't.
So at what point does one go for surgery? Because then you would say if they have reached a point where they cannot be treated anymore, then the option is surgery.
That is when they have recurrent infections, or when they have enlargement, which we are talking about today.
Okay, so who is prone to getting these infections? Who is prone to having their tonsils, enlarged?
So most of the times it is a child will be prone to that in case of recurrent infections or in case of allergies. When patients have allergies, they can have a reaction from those organs trying to fight off dust or cold air, so they enlarge. But most of the times it's because of recurrent infections, and sometimes it's not a recurrent infection, just one infection can be enough to enlarge those tonsils. The infection is treated, but the size of the tonsil does not go back to normal.
Okay, so why is it very common in children specifically?
Well, because their immune system is still not yet mature, and they are still the immune system actually is discovering the world, but also because of that they will have recurrent infections. Also, schooling children have a higher chance of getting these recurrent infections since they are in a small classroom and they are in big numbers, and any infection can spread easily. The other issue is also transporting a child early morning in the coldness to go to school. So they're exposed to the early morning coldness with humidity in the air, so they can easily get affected. That's why most schooling children have a runny nose, a cough, and it can be one of the causes for enlargement of your tonsils and adenoids. But also adults can have that. In case of infections or recurrent infections, a slight number will have it because of a cancer in the tonsils.
So for the adults, then it becomes even cancerous?
Doesn't really become cancerous because of the recurrent infections.
Okay.
But if you have an enlargement in an adult, especially if it's just one-sided, you have to suspect a cancer. Like if you have the right tonsil or left one being enlarged and the other one is a normal size, you have to see a doctor. It could be a cancer of the throat.
So what are the symptoms? What are those telltale signs for a parent that is watching us this morning on CTV? They would like to know, how are they able to tell that my child is actually having this condition? Because a mom or a dad would brush it off as they'll outgrow it if they're snoring, or if they'll brush it off as an allergy infection as well. So what are the telltale signs that actually this is a condition that needs to be treated?
So the most frequent symptom that the baby or the child will have is snoring. The child will be snoring every night, and it won't be like snoring once in a while. It is snoring every night. That if it is chronic, then chronic means it is for a very long period of time, then it's most likely because of a big size of adenoids or tonsils. And the next symptom is to actually breathe through the mouth. So the child is always opening the mouth, breathing through that. This affects appetite in children because they breathe through the mouth, so they can't take time to chew food, and that's why you will see our child not wanting to eat food, rather wanting to drink juice or drink water, or maybe even eating snacks. They prefer eating things which are easy to swallow, which don't require to chew. And most of the times parents think that, oh, my child has no appetite, and we buy vitamin syrup.
Yes.
But in reality it needs a checkup to see why we are having that enlargement.
Okay.
Then other symptoms which are more alarming, if the child starts to have difficulty in breathing, you will see it by the child moving like frequently around the bed, trying to look for a better position to breathe. They can be like suffocating, and then they restart breathing suddenly. So you'll be like snoring, then suddenly stops breathing for a few seconds, and then restarts as if he was thrown in a basin of water, as if he's catching breath. Then sometimes actually it can be more alarming, where it will be frequently happening. The patient has to go to seek medical attention. Another sign is having a runny nose, to like frequently day and night. That's because the adenoids are too enlarged. They block the normal drainage, like the mucus that is poured by your nose is supposed to go on the back to the throat, but in this case, because the nose is blocked on the back, the mucus stays in your nose, and the child will have frequent flu. So the parents think that they have 3 months of flu. That is not an infection. It can't be. Other things will be like cough. Those enlarged tonsils can trigger a cough, so the child is over coughing. You give them all the time cough syrups, but you don't see any improvement. So you really need to see an ear, nose, and throat specialist who can examine and assess.
I'm so glad that we're having this conversation this morning, because the doctor here has pointed out a number of signs and symptoms that very many parents would rubbish off as a simple cold, as just, you know, a day when a child hasn't slept well. Because when you talk about constantly having a running nose, when you talk about the child is constantly coughing, when you talk about the child not even wanting to eat, very many parents would say, okay, let's buy vitamins, let's buy mukene and all these things, you know. So I think it's very important that the parent that is listening this morning understands that, hey, guess sometimes you actually need to take your child for checkup, because you might be treating something that is actually not there. You highlighted something of a child sleeping with the mouth open. Is because I realize even some adults even sleep with their mouths open. So is that still a sign when it comes to the tonsillites enlarging as well?
Well, for adults, it could be another reason why it is located in the nose, maybe in cases of allergy, but it will be more of difficulty in swallowing. The patient or the adult will feel like they have difficulty to swallow food. They really feel like they have an obstacle in the throat that is stopping food from passing normally, but also they will have snoring and mouth breathing. Yes.
Okay. So finally, as we wrap up this conversation, what is the treatment for this kind of infection, for this kind of condition? So
usually you will have to go and see a specialist who will examine the patient to diagnose. We can actually clinically, by examination, see that the tonsils are too enlarged, too big in size, and sometimes the doctor will ask for an X-ray that will help us to see the size of those adenoids on your back of the nose, to see also how narrow is your air space.
Yes.
And then the treatment needs most of the times an operation where the child is put to sleep, and then the tonsils and the adenoids are removed without leaving scars because it's done through the mouth. Most
Okay.
of parents fear scars remaining. It's a procedure which is done as a day case, meaning that you get admitted in the morning, get operated, and then you go home in the same day.
Interesting.
Yes, and we give the patient antibiotics, pain killers, so that they don't feel pain after. And within few days, you see that your child is all right. For the feeding, it's gradually given. We start the following day with warm, soft foods. So there is no worry about feeding, because most parents would be like, oh, if I operate the throat, how will he eat?
Yes. Yes. So is in any way, my last question is, in any way, how is there how nutrition or what we eat goes hand in hand with this particular type of condition, or there is no similarity between the two?
No, not really, except that if a child is already not eating, it makes him to be weaker, and they will be prone to infections more frequently, so it will worsen on the condition if you have recurrent infections.
Okay.
Yes.
Any last remarks before we close?
I would like to tell the mothers, be careful, listen to your child, don't take things lightly. If your child is snoring, please seek medical advice.
Okay. Well, thank you so much for giving us your time this morning.
Thank you so much also.
Absolutely. Well, that wraps up what I had for you today on beauty, wellness, and lifestyle. And I hope that you were able to pick a thing or two. Otherwise, we still do have an amazing show lined up for you. Of course, special thanks to Yasmin Health Center for allowing us to use their facilities this morning. Keep watching Sunrise at Sea and don't blink.